Hello, and welcome to Tech Talks, the People and Planet podcast. On this episode, I'm joined by Tim L Hommedieu, the Senior Vice President at Health Tech Business, Atlas Health. Hi, Tim, how are you?
I'm doing great, Lee. Thanks for having me.
Thank you so much for joining us. This is going to be excellent, I'm sure of it. Let's start at the start, Tim. Atlas Health, talk us through the problem that business is solving with the mission. And perhaps, if you can, what's inspired that as well?
Yeah, I'm happy to. So I think I know you've got a wide variety of listeners, both inside and outside of the U.S. So for those that are outside of the U.S., the U.S. has a very unique healthcare system in which the facilities and the providers are largely privately owned. And health insurance is obtained through a variety of mechanisms. I would say the big three are either employers, private purchase, or through government-based programs like Medicare or Medicaid. And overall, most of our patients are going to have a substantial out-of-pocket financial responsibility for the medical services or prescriptions that they're prescribed or recommended. And as a result, there's going to be financial obstacles which we find impact access, affordability, and financial toxicity. And that last one, financial toxicity, is really been something that's being more studied. In essence, what it is the harmful effect that high-cost medical care can have on a person's quality of life. And they found that stress of having to pay the medical debt actually impacts the clinical outcomes of the service. And so I think the good news in the US is that there are thousands of philanthropic programs which provide patient assistance. And this philanthropic aid market, also commonly known as patient assistance programs, has billions of dollars available. However, the challenge is that money is spread across thousands of different programs, each with their own eligibility criteria, funding mechanism. And so you can imagine if you're a patient who's in need of trying to find some element of financial support for an upcoming medical service, tapping into that market can be incredibly intimidating, complex, and where do you start? And so we've really approached this to try to solve the problem with technology. And we partner with healthcare providers in the US who leverage our technology or tech-enabled services to effectively screen all of their patients for eligible patient assistance in this market. And we automate many of the manual processes, including eligibility screening, application submissions, and post-enrollment workflow. And so, largely the service and technology has been really well received by providers who are now able to support their patients' financial responsibilities and also maybe selfishly cover their services as well. Because when patients come to providers in the US, oftentimes the service can be rendered and then a bill is sent to the patient, sometimes 60, 90 days post-service. And so that puts pressure on the patient, but also the providers looking to recoup their costs in the service.
Yeah, of course.
So, and of course, we've sort of covered the business element or the financial side of this scenario, but I think what really drives our company is the philanthropic nature of it, is our team, our people, our technology really is making a difference in people's lives.
Really, really interesting. So if you could just kind of unwrap the people that are involved in this then. So how do you qualify for the philanthropic aid and how many people is that roughly?
Yeah, when you think about the amount of money, there's about $30 billion spread across 20-something thousand programs. And so somewhat of finding a needle in a haystack, so to speak, for patients. A lot of stakeholders, I think, have health literacy issues. They're focused on trying to get back to work. They've been diagnosed with a challenging cancer or some other chronic condition. And the last thing I think all of us, when we're having and going through that, want to do is research on how do I pay for the services and prescriptions and drugs that I need to get better. And so what we've in essence done is we have a cloud-based platform, and we start by ingesting key pieces of data from our providers' electronic health records and other ancillary platforms. We utilize some complex logic and matching engine rules to intelligently match the patients to the most suitable and appropriate programs. And this removes that big manual process of either patients independently searching for programs online, or what we see commonly in the US is that is a service that the providers are rendering as part of their patient experience, to make sure that people can afford their services and will pursue the therapeutic recommendations that have been made. And so we also leverage some robotic process automation to ensure we have an accurate status of every program available. For example, one of the types of programs is a diagnosis-based assistance foundation.
Okay.
And that type of program provides funding or grants based on the type of diagnosis you have. And so because there's such a large demand for this money, those programs typically receive donor funds and then they're exhausted relatively quickly. And so while their eligibility criteria is fairly wide, anyone with diagnosis A, the funding dries up quickly. And so one of the things that we do within our platform and services provide some visibility as to which programs have funding and when.
Yeah, okay, I get it. And I think you touched on that there with the robotic processes, but I was going to ask you around the AI, and that would tell the patient which ones of these programs that they're eligible for. Is that right?
That's correct. Yeah, we're continuing to lean into that on how we can really leverage AI and ChatGPT and some of the other newer technologies to streamline matching, streamline eligibility opportunities, and also leaning into the program and foundation side of the equation. We've historically really been focused on the providers and patients, how we can connect them to the established programs, but it's really a two-way market. You have stakeholders, drug manufacturers, 501c3 foundations that are looking and have funds that want to support a specific type of patient, a specific drug. And so they're also interested in streamlining that process, reducing any friction on how they can support the patients and the providers in that space. And so I think with AI, we have an opportunity to maybe work both sides of that equation so that we can effectively make that a smoother transition and access.
Got it. Thank you. So yourself then, Tim, you are SVP of Pharmacy. Where does that role fit into this whole equation then?
Yeah, good question. Pharmacy runs deep in my blood. You can see some of the old pharmacy relics behind me here. I'm a third generation pharmacist, and I've spent most of my career on the health system side for hospitals. It's a large integrated delivery network. And a couple of years ago, I came over to Atlas Health. And I'm in essence a subject matter expert in this space and lead our pharmacy experts and solution architects. So we support our commercial team, really enable the provider clients to better understand how our platform can support their organization and strategic initiatives. I also do a fair amount of presentations and public speaking to raise awareness around the opportunity in this space. And I think my experience in healthcare in the pharmacy industry also allows me to provide some insight and engage with our product team on new initiatives. We just talked about some of the opportunities to maybe serve more as a comprehensive marketplace to connect patients and programs So certainly that's part of my day-to-day role as well.
Very interesting. Hopefully we can touch on that a little bit later on as well. But just before that, I'm keen to understand where you guys have come from. So, you know, the business was founded only 4 years ago, 2019. Of course, there's been a lot going on in the world since then. But you guys are already, I think you're at 100 employees roughly. It's never plain sailing with startups. Talk us through the challenges and how you've hurdled those.
Yeah, I think just from a starting point, our founder had some friends who were going through some medical challenges and had some affordability issues, and they went on social media to raise money to actually access the care they needed. And I think that really touched him, thinking, you know, we're living in a developed country in the United States, and there's a pretty large insurance structure, healthcare system, yet someone that I know that is successful is having to raise money from friends and family in order to support medical care that's essential to their health. And so as he dug in, I think he found that there was this market and this fragmentation on, you know, how do we help support some of the patients that are falling into this space? And so we've certainly had our fair share of headwinds as well as tailwinds. One of the challenges more recently in this market has been some of the health plans and pharmacy benefit managers are actually modifying the plan designs to take advantage of the patient assistance market for the plan rather than the patients themselves. And as anyone knows, any loophole is going to be exposed. And what that's doing is creating, in essence, a funneling of the available funds towards the plans and prescription drug plans rather than the patients themselves. And so now you have a contracted supply scenario with an even larger demand. And the programs that provide the money have responded. Several of the drug manufacturers have modified their eligibility criteria or cut back on their copay structures or the free and replacement drugs that they provide. And so that's created more demand on the diagnosis-based assistance foundations, given a portion of the programs have cut back their available supply.
Wow. Okay.
So that's been a challenge for us.
Yeah, of course it would. I can
Um,
see. Lastly, and just going back to what you touched on before, you know, what's next? And I think this goes back to your own position. What can you tell us that's exciting coming up?
Yeah, you know, we touched on some of the headwinds there. We've also had some
Yeah.
tailwinds. The CMS, Center for Medicare Services, which in essence oversees some of the large governmental programs in the US, has actually put out some mandatory regulatory metrics that are around health equity, deemed the hospital commitment to health equity. They really want healthcare providers in the US to do a better job at addressing some of the healthcare disparities across our country. And so that, combined with some of the accrediting bodies in the healthcare space, have also put out similar health equity metrics. And so what used to be more of a philanthropic mission-based element for providers in the US to support their patients in this space is now becoming more of a compliance and required activity.
Okay.
And so that's, I think, great for both the country, the patients. Obviously, we view ourselves as a key partner in this space as folks are looking to ramp up their service, their infrastructure. How are they going to execute on some of these asks from CMS and accrediting bodies? And so on our front, you know, we're trying to make sure that we position our product and services in a space where our users can use this more in line. Right now, we have a cloud-based platform which works really well, but ideally, we'd like to have that embedded in the applications that the variety of our users are using today, so they're not having to move out of their workflow or out of an application. They can stay within the electronic health record, pharmacy management system, whatever they're using today to do that. I think another big piece that we see is combining some of the other activities that go into the access and affordability equation, most notably prior authorization. And for those that aren't familiar with that, in essence, the payers have utilization criteria for specific medical services or encounters that they've deemed need to be met in order for the service or prescription to be covered. And a lot of times the prior authorization and the patient assistance go hand in hand, because depending on the outcome of the prior authorization will dictate the patient's out-of-pocket responsibility, the coverage, and what type of support structures needed. So we're going to be bringing a prior authorization solution along with our patient assistance product here shortly.
Oh, wow. Interesting. And what's the timescales on those then?
Yeah, we're going to have the patient assistance offering here in the next month. So we're excited about that, both for medical benefit, so for the authorizations that are needed on the medical side, as well as on the pharmacy side. And then I think moving forward into 2024, how can we create that more inline, seamless workflow structure within the platform?
Really interesting stuff. Tim, thank you so much for joining us. It's all we've got time for. Guys, this has been Tim L Hommedieu from Atlas Health. Tim, thank you.
Thanks, Lee.